I'm Bryce Spielman, and I'm here today not only as the founder of Academy of Therapy Wisdom and wisepractice.io, a new platform we launched in June dedicated to supporting mental health professionals and managing and marketing their practices, but also someone deeply concerned about the future of the mental health profession. Since 2015, our team has been on a journey to support mental health practitioners, helping them by creating incredible training programs to give them the skills and confidence to work with their clients. We've had the privilege to work with some of the most renowned experts in the field, from launching Diane Poole-Heller, who I originally met Ellyn back, was it 2015, Ellyn? 2016?
Probably, yeah.
It was a while ago, right? A decade. And we've worked with Dick Schwartz for many years, Pat Ogden, Terry Rio, Esther Perel, Thomas Hubel, and many others. And then when the pandemic hit in 2020, and when George Floyd was killed in May of that year, which was not even a mile from my old house in Minneapolis, the world was turned upside down. And we responded by launching the Academy of Therapy Wisdom to support therapists through these challenging times and wanting to explore the intersection of psychotherapy, spirituality, and social change. Then a few years ago into the pandemic, and with everything else going on with the heightened awareness of racism, political divisions, obsession with social media, and global warming, we noticed therapists were exhausted. Demand for therapy was through the roof, while at the same time, therapists were quitting and retiring. So with so much burnout, we realized that no one was taking care of the caregiver. So after many of our trainings, we started offering yoga and breathwork sessions. If you're part of Therapy Wisdom, you probably see my wife, Dee West, after Janina Fisher's programs or Trauma Wisdom Circle. And we're really excited to offer this. After helping to alleviate that issue, we thought, okay, let's get back to course creation, which is what we do best. But today we're facing another critical challenge with far-reaching and very long implications for our field. And this challenge is not just about adopting new technology or shifting cultural trends, as Ellyn Bader points out in her amazing network article about the very soul of the profession. It's about the intrusion of venture capital and private equity into the sacred space of therapy, a space traditionally about healing, connection, and trust. And venture capitalists are savvy. I do have an MBA, so I've been with these people. And they recognize the enormous demand for therapy, and they want a piece of the action. And my concern is that big tech companies do not inherently have the client's healing in mind. They have clearly evolved to systematize care to the point of making clients a commodity. And I was telling Ellyn right before this call, I personally experienced that exploring some of the online ketamine therapy programs, where, for example, I was supposed to take 400 milligrams, and I decided working with somebody locally to only take 200, and they shamed me that I didn't follow the protocol. And then the other concern is big tech companies have a bias in keeping clients happy. And a concern that one of our presenters last week told me, Vanessa Scaringi, mentioned in one of her blogs that these companies are more interested in a 5-star Yelp review and keeping the client happy than risking resistance from the client and doing the hard work. I know personally there was moments in my therapy sessions where I was not too thrilled about my therapist putting the hard work and making me rather uncomfortable at moments and pointing to the work I need to do. And just to be clear, I'm not trying to be anti-money or against capitalism. I'm just saying that client care needs to come first, second, and third. And I think it's why we're all here today. And why should this matter to you? And I think the answer is simple, because and Ellyn's article really points this out. It threatens the integrity of the work you do and the human direct relationships you build with your clients. And as the demand for mental health services have skyrocketed, venture capitalists have seen an opportunity to profit. Companies backed by these investors are flooding the market with massive advertising budgets, offering therapy services, prioritizing profit over quality care. And it's simple math. If you invest $1 million in advertising, you need to earn that money back in profits. And who pays? The therapist is only getting 35 to 50 bucks an hour. And how much are VCs buying? See if I can share this slide. This is the closest chart I got for 2024 VC investment. Health, care, and biotech was almost $16 billion, exceeding even AI, twice as much as financial services, manufacturer hardware. I don't have data which part is but healthcare and biotech, but it's significant. And as you see, it's just not a theoretical concern. It's happening right now, and it's reshaping the landscape of mental health care in ways that could or will have very lasting consequences. We're seeing therapy commoditize with the focus shifting from deep, meaningful engagement with clients to a more transactional, superficial approach. So this isn't just about also therapist-client relationship. It's the sustainability of your practice, your livelihood, and your ability to deliver the kind of care that truly makes a difference. So today, we're really fortunate to have with us Dr. Ellyn Bader, a pioneer in couples therapy and a leading voice in our field. Ellyn has seen firsthand the impact of these changes, and in her article in the Psychotherapy Networker, Is the Soul of Therapy for Sale? She highlights the alarming trend we're witnessing. And she'll be sharing her insights on how private equity is infiltrating our practice and what this means for the future of therapy. And before I give the stage to Ellyn, I just want to underscore one critical point, that the time to act is now. We need to be informed, vigilant, and prepared to protect the integrity of our practice. It's more important than ever that therapists who want to stay out of large therapy technology companies have the support they need to build thriving private practices. And supporting the small businesses of therapists, exactly why we had in mind when we created and developed wisepractice.io, a platform designed to help you stay competitive in this rapidly changing environment. By leveraging our tools and resources, you can maintain control of your practice, deliver exceptional care, and continue to thrive, even as the landscape shifts around you. With that, it's my pleasure to introduce Dr. Ellyn Bader. Ellyn, see where you are on the screen. Thank you for being here to share your experience and perspective. And your article had such a big impact on our team and inspired us to do what we can. And we wanted to share with everybody. And it also shows just your leadership in the industry. So welcome.
Thank you, Brian. Thank you. I'm happy to be here. And Brian and I ran into each other at the Psychotherapy Networker conference. And it was, we hadn't seen each other or talked to each other in quite a few years. And it was really great to hear that our missions overlapped so much. This is a topic that I feel very, very strongly about. And you're going to hear that as I do some of this presentation. What I would like to do is ask those of you who are here, when you think about the soul of psychotherapy, just put in the chat like a phrase, like what is important to you about your work? What is important to you about the soul, the heart, the reason you got into this work to begin with? What is it that really, really matters to you? And I would love to read just a few of things that you have to say. And, I'm seeing things like building relationships, the connection. A lot of you are reflecting on the building strong relationships with clients, helping clients get better, being with someone in their suffering. And also some of the aspects involved in having freedom in your work. So I am going to share my screen and share with you a PowerPoint that I created. And Brian will periodically interrupt me. He'll ask me questions. If you want to put questions in the chat, please feel free to do that. What I'd like to do is run through a lot of this and then continue to have a conversation about it. So first of all, I first created parts of this PowerPoint and delivered them it was about, I think, 18 or 19 months ago. And at that time, I said, the future of therapy, what you don't know can actually hurt you. And that was my warning webinar in 2022. Now, that future has happened. And when I first did this webinar, like a lot of therapists really did not take what I was saying very seriously. But as I'm talking to more therapists now that the future is here, many therapists are starting to feel what I predicted in 2022. So as Brian mentioned, like during the pandemic, I think we all got complacent. We had to shift to being online if we weren't already online. So there was that beginning of learning how to be online. Um, but then during the majority of those years, therapists were in super high demand. And so therapists didn't have to market themselves much. Therapists couldn't make referrals to other therapists. They had waiting lists. And so it just seemed like that was going to continue indefinitely forever. Um, and, this was a quote from a particular therapist, but talking about how it was like nothing that had ever been before and how every available time slot was filled. And it was true. In my area, I could not make referrals. Like it was really, really almost impossible to find a good therapist to send someone to. Um, and at the time, this was from when I first did this, because I do lots of couples therapy. Couples therapists were saying, couples are really massively struggling as a result of the pandemic. They're too much time in the same space. Um, and there were also a lot of conflicts. There was huge conflicts around safety, around vaxxing and anti-vaxxing, around racism, around political divides. I mean, and people were stuck claustrophobic in this space, and it was, exacerbating addiction, alcoholism, anxiety, depression, all were on a major increase. And so the pandemic led to a huge, huge expansion in telehealth. And I'm not anti-telehealth, so I want to be clear about that because it does make care sometimes more affordable and more accessible. Um, Now, when I first did this presentation and I was researching and trying to find out what was the average that a therapist in private practice was making in the US. And at that time, the average was around $110 an hour. It's at now when I researched it just in the last 2 weeks, the average that is coming up repeatedly on sites like ZipRecruiter, Indeed, salary.com, all the ones that report salaries, the average has gone down to $97,000 a year. But I think most of you know what some of the benefits are of telehealth to therapists. I mean, for one thing, lots and lots of therapists have given up their offices. So there's a big price savings in terms of, not having to pay your office rent. You can cover a broader geography in your state. For a while, you could even work across state lines. It makes scheduling much more flexible because you could work from home and you could do something and then go see a couple of clients and then go back and do something else. And a lot of therapists actually reported liking the intimacy of being able to see into people's homes. You could see their pets, you could see their kids. And that was actually adding a new level that was enjoyable for therapists who were working. And mostly we've talked about all the ones that are up here on the screen right now, but clients liked having a broader range of therapists to choose from. They could also cover a larger geography. They didn't have to travel. It was more convenient. And in fact, it's really interesting. And this is another thing I'd love to see some of you put into the chat. In my office, for the first time last Thursday, every office was full. And that was the first time since the pandemic. There are 7 offices in the building that I'm in my immediate office space. But that, the pandemic has officially been over for quite a while. And still, the majority of people are liking working at home, liking working on Zoom or whatever platform they're using, and not being in person, even though almost every therapist will say there's something lost when you're not in the immediacy of being in the room with a client. And so when I did this 2 years ago, I talked about the beginning destabilization of the mental health field. And then there were huge changes taking place in the marketplace, but most therapists were pretty oblivious to it. And I think of it as like there's two big wrecking balls that are targeting all of us in the mental health or psychotherapy profession. One is what Brian was talking about, the invasion of private equity, and I'm going to talk some more about that. And then the other is the pathologizing of so much of the human condition and medicalizing so much of the human condition. And along with that comes an amazing set of regulations and requirements that take the creativity out of our field.
I'd also want to add Ellen having a teenage daughter, a new,
Yeah.
and Vanessa Scarring is on the call, and she talked about it in one of her blogs. There's also this culture that everybody needs therapy. Like if you look at TikTok and teenagers, um, I mean, in some sense, it's great that therapy's gotten more open than hiding it in the past. It's gotten to the point that everybody wants a drug and a diagnosis.
Yes, absolutely. I can't actually see the chat, Brian. I don't know if anybody put anything in when I just asked that last question or not. Is there did anybody, are you able to tell?
I don't say anything. You want to
Okay.
ask your question again?
Well, it's all right. I was just asking about how many are back in person and how many of you are still completely. So maybe just put in, if you would, like I'm 100% online, I'm 10% in person. I'll never go back in person again. Like it would be nice to get a feeling for uh, how some of you are thinking about it and what you're actually doing.
It's all over the place. 100% tele, in person, 50% in person.
So I think that's what's happening right now. It's a little bit all over the place as some people are very much committed to never going back in person and many are in person. And for the first time, I talked to a couple of referral networks. It's for the first time in the last, let's say, 3 to 6 months, clients are asking for in person again. Um, And so, as Brian was talking about earlier, I think therapists need to rally together. We need to really be able to understand what's happening, why it's happening, and then think about what it is we want to do about it. Um, and so, the first thing I'm going to talk more about is the private equity issue and the corporations that are invading our workspace. And I've put up here the names of some of the common ones. There's Talkspace, BetterHelp. Those are the two I'm going to highlight in this presentation. There's Regain, Refresh, Iris, Seven Cups, Joyable, Wobot, Alma. I mean, there are many, many. And every time I turn around, I had a therapist call me yesterday and send me a note saying, should I join this one? And it was one I had never ever heard of, but they reported having 2 million clients that were using their platform. So it's happening everywhere. BetterHelp is one of the biggest ones. They have over 35,000 therapists signed up. And if you are on here and you're signed up for BetterHelp or Talkspace or one of them, toward the end, Brian and I would love to hear your experience and hear whether, some people have had a good experience, some have not. But supposedly there's 35,000 therapists currently, and over the time that BetterHelp has existed, they have 4 million individuals who have gotten help from the platform. And they've had a lot of high profile celebrities advertising them. I know There was a time on the Olympics where they had Michael Phelps, and and almost every time, at least in California, every time I turn around, there's an ad for BetterHelp. So BetterHelp and Talkspace are both publicly traded companies, and they are investing huge amounts of advertising dollars to bring in clients. And again, as Brian said, they're conveying the notion that everybody needs therapy. You can always benefit from therapy. And they play a bit. I mean, one of the recent ads from BetterHelp plays on the idea that if you get a therapist who you don't like for any reason at any time, it's like that, and you can just switch. So it's an interchangeable commodity that you just throw out one and bring in another. But they make it sound very, very appealing. And they're very, very active in recruiting and looking for therapists who will join these platforms. Now that statistic was what I had previously. The one I just got, the most recent one. Now they're saying 27,000 therapists in their network. That their primary goal is to make mental health care accessible by providing affordable, personalized therapy online. And there's a link here, and you'll, I think, have the slide somehow in the replay. This is a really, really excellent review of Talkspace. It goes into a lot of detail about both positives and negatives of Talkspace. So if you want to dig into it a lot more deeply, I'm giving you this reference as a way to do that. So I want to talk about some other things that are happening, which is not only are they massively trying to bring in loads of clients for psychotherapy type services, but they're also buying up practices and treatment centers. So if you think about the variety of kinds of treatment centers that have existed over the years, things like addiction or autism or I'm just a variety. I mean, anorexia treatment or whatever it is, the different kinds of treatment centers, the private equity companies are buying these treatment centers. They're also buying up private practices. And again, I'll ask you in the chat, do any of you have a private practice where you have been approached to sell your practice? If you're in a very small practice, probably not. If you're in your own solo private practice, probably not. But if you happen to own a practice that might have more than 10 or 15 therapists working for you, and you're in a major geographic area, there is a possibility that you have been approached to sell your practice. So again, a quick look. Did anybody in the chat have any of you been approached?
Vanessa said several times. Anybody else? And Nicole said many times. Koi said, I've been approached. And Koi mentioned that people in our area banded together for survival.
I don't know if you're willing to put what area you're in, but it would be nice to know, and it's good to hear that you are banding together. So, these companies have millions and millions of dollars. In my saner moments, I think that they're actually probably going to go bankrupt in another few years, but we don't really know that, and I don't know that that's going to happen. But they're putting profit first, and there's a drive to make money and to make the shareholders happy. And so lots and lots of the decisions that are made from a profit motive rather than from an understanding of what is in the best interest of a client and also what is in the best interest of a therapist. And one of the reasons that private equity is coming into the therapy world is that it's easy entry. It's not that expensive to buy up a therapy practice. And so it enables them to move in and move fast. And like I said, I was talking to a friend who lives in the Midwest, and she was saying that in her area, all the practices, the health clinics, and the treatment programs, there's not one left that is not owned by a private equity company in her Midwestern state. So what that results in is wages going down for therapists, instability in the market, and very inadequate support for therapists and their clients. Um, and my husband wrote actually a very funny thing, very sarcastic, very funny thing about the use, comparing Starbucks with these big private equity companies. And I thought I might sprinkle through this presentation. It's a couple of paragraphs at intermittent places of what he wrote, understanding, of course, that, like I said, it's tongue-in-cheek sarcasm. But he says, I'd like to compare Starbucks to BetterHelp. I mean, after all, what are all the benefits worth to a Starbucks employee? It's hard to calculate, but the attitude of Starbucks toward people they hire goes well beyond the attitude of BetterHelp and what they provide for therapists they hire. For one thing, BetterHelp is willing to violate the sacred principle of confidentiality without telling therapists. I doubt Starbucks violates venerated values of their employees. Starbucks says, we value you, our employee. BetterHelp says, we're willing to take advantage of you if you are having trouble financially. But we'll define it differently. We'll define it as augmenting your income versus we are offering to pay you an insulting fee, even if you have exceptional experience, because we don't value your experience over a newly licensed therapist with zero experience. You'll both get paid the same. We'll pay you what we pay a raw rookie because you need to augment your income. And because you have some financial struggles, please overlook the insulting pay scale you get as a professional. So I don't know, Brian, if you, I'll save some of the rest of it for later, but do you have any reaction to that?
I would just think how we give Starbucks Yelp reviews, and I was going to ask you, like, companies like BetterHealth ask their customers to rate their therapists, which means they're asking clients to assess whether they feel better after a limited number of sessions. And I just wonder, what do you think that does to help or hinder the way therapist is perceived, or how you would practice if you need to leave with the client, with 5 smiles on their face?
I think it has a lot of impact. For one thing, I mean, there's research in the field, and Scott Miller's done some good work on getting clients to evaluate their therapists. But if you're constantly being evaluated for what you're doing in the therapy, therapists are going to be very cautious about making confrontations, holding up that mirror for when somebody's behavior may be really out of line or very dysfunctional, but you don't want them to go away feeling upset. And so you might be much more inclined to tiptoe around somebody like that. And the other thing that's really interesting, like I was with some friends. This is probably a year ago now. I was with some friends. It was a Saturday night. We were sitting out on her deck in Southern California. We were talking about some of this. And one of the women there said, I think I'm going to call BetterHelp and see if I can get an appointment. And so she just acted like very impulsively, spontaneously, and went to the website and requested an appointment for her and the guy that she was dating. Well, literally within 5 minutes, there was a response. So that was really great. I mean, she got an absolute, immediate response. The therapist was texting back and forth with her, but asking questions that were completely irrelevant to what she was seeking.
Do
And
you think it was
finally,
a bot? Do you think it was a bot?
I don't think so.
Hmm.
I don't think so because my friend said to her, to whoever was texting with her, can we just set up a time instead of continuing to text? I would like to set up a time, and I'd like to get my boyfriend to come with me. And so the therapist set up a time with her, and they set up a time just a couple days later for her to go. And she went to the appointment, literally with a real problem. The real problem was I really like this guy that I'm dating, and he was there too. But when we go out, he drinks too much. And that scares me. And also, when he drinks too much, he starts flirting with other women, and that's a challenge for me as well. So, but first of all, the whole beginning of the session was question after question after question about her family of origin, and the session was set up for 45 minutes. So my friend said to the therapist at one point, she said, look, we only have about 15 minutes left, and I haven't even told you what my problem is. Could we please talk about why I'm calling in for this appointment? And the therapist said, okay. So she proceeded to talk about his drinking. There was never a question to him about how much do you drink? Do you think your drinking is a problem for you? None of that. And the therapist wrapped up the session by saying, I'd like to send you some questionnaires for you to, or some exercises for you to do after this session. And after you've done them, then let me know and we'll meet again. And the major exercise was how to apologize. And what, she said to the guy, sort of, I think you should apologize for what you do when you're out. So at that point, my friend just canceled and decided not to do any more sessions. The 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 point is that there was never a minute in that 45 minutes, which is way too short of a time for a first couples session anyway. But there was never a time where the client felt like the therapist was connecting with what was really her problem and what was going on. Um, and so she left that experience feeling very disillusioned.
I think you cover this in your article, but it sounds like she was locked in to completing an assessment form and was just trapped to do that. That had nothing to do with the situation.
Exactly. Exactly. I mean, it was clear that she had, a checklist that she needed to go through. And um, most of us, when we went to graduate school, one of the first things we learn is um, how to connect with a client, or how to be empathic, or how to, like, even to say something like, gosh, it must be hard for you to be worried about his drinking when you're out in public. There was nothing like that ever took place in that session. Um, and being confined to 45 minutes this is a different topic, but something I teach about a lot is that 45 minutes is just not an adequate period of time for a first session with a couple. And so every couple that is going through one of these telehealth platforms is being channeled into that 45-minute period, which is, I think, leading a lot of people to come away from therapy not having good experiences. And those of us in private practice who are then following up later with getting some of these clients are hearing more and more often about the bad experiences that somebody had in therapy.
Boy says it really well. It's McTherapizing,
It's what? Mick?
McTherapization.
Yes. Yes. Yeah, so this was just a quote from somebody, a therapist in January of 22, again, on the same thing about private equity taking over the mental health therapy market. Um, and when private equity comes in to, let's say, a treatment center, they usually have a short-term focus of about 4 to 7 years where they have to make a profit. And so they initially can come in, load up with a lot of debt, and then eventually they need to find a way to make a profit. And one of the ways they make a profit is, they take it from the salary of the people working in those facilities. And so, for example, my friend in the Midwest who was talking about some of the addiction centers, what the nursing staff and in those residential treatment centers what they get paid has gone down unbelievably amount in the last 5 years. Um, okay, again, just another quote. I don't think we need to.
I think we're getting a lot of chat, Ellen. What can we do?
Okay. Well,
But
I
it doesn't
think
have to be this moment, but
what?
it doesn't have to be this moment, but just letting you know.
Yeah, no, I mean, I hope you and I are going to have a discussion about that and with people who are on, and I would also love for people to come on and talk about their own ideas as well. And I don't, I'm not trying to belabor the point. I think when I first put this together, like nobody believed how serious it was. So I like overdid it on some of these slides. But it's this, the soul of what we offer, the soul of what we even teach is being ripped away in so many different ways. Just this is a little bit of a tangent, but not too much of a tangent. I mean, I've been doing couples therapy for 40 years. I probably have supervised or consulted on more couples cases maybe than any other therapist in the world. I don't know, but it's possible because I've been doing it for such a long time. Um, and it's getting to the place where the requirements to present at a conference is soon going to, if I was 100% honest, would make me ineligible to present because of the regulations that are coming about for, very strictly evidence-based work. And usually now they're looking for evidence-based that has been proven in the last 3 to 4 to 5 years. And so and Brian, you can probably speak to this from your own community, but the therapists who are creative, who are doing tons of work, who are in the trenches with their clients, they're not sitting in academia doing research, probably are much more in tune with what actually happens in the therapy process and how to make a difference. But they aren't what is being venerated in our field right now.
Yeah, I think many of us on the online training in the last 2 years when APA, I think they got a new czar of CEs, just anything that's somatics, anything with touch. I mean, we have great presenters like Janina Fisher, who's an incredible pioneer. She won the award from the Networker as Therapist of the Year expert. And even her work, we cannot get CEs. I mean, we're about to start a study in Denmark. But studies are expensive, they're timely. It's gonna take 2, 3 years. And just being cut out from that process.
What's the rationale they give you with Janina? Just no rationale, just they don't.
There's no evidence base.
Yeah, and here's
That's the
just,
holy grail.
yeah, a wonderful skilled person and practitioner who, um, by the powers that be that are not mental health people, usually are cutting out our learning from people that we should all be learning from.
Diane wrote Carl Jung would be out of a job.
Yeah, yeah, for sure. Yeah, and then, we also should talk, and I'm gonna finish going through the slides in a few minutes, and then we'll talk about issues. And one of the issues I think we should talk about is the impact on clients of the what is evolving, and how do we begin to talk to that as well. So let's see. I mean, you're going to have all these. They just have a lot of quotes in them. This was interesting. I was approached 2 years ago by a recruiter from BetterHelp, and I decided to make the appointment. But this was what I got in my email box, and I really loved what he said when he said, um, you know, I thought you would be a perfect person to join. Uh, this can be a way to supplement your private practice or your income. And they're getting smarter and smarter about the things, quote, that they will provide that therapists are nervous about. Like most therapists don't love to market, as you well know, Brian. And when when they'll take away the anxiety of marketing, it's a very strong pull for a lot of therapists to sign up on these panels because of that pull. Now, I had since that, this was 2 years ago, since that time, I've actually received many more solicitations, and probably most of you have too. Um, Twice I made appointments, and I got all kinds of text reminders, and then the person never showed up and never recontacted me. So I thought that's interesting. They must be getting a lot of people responding, or I don't know why they just never showed up to the appointment that they made with me.
I'm feeling the anxiety of people wanting some solution. And what I just thought of is like, how do we do this as an industry? And like every therapist could have a paper. Like, why do you want a small business or locally grown? We see that in the food industry, local. I'd be glad to give a draft. People want to help. Some ideas about that, like that we're talking about, that every therapist just to educate the public.
So what do you imagine going in that?
Well, it's personalized. We care about your long-term wellness. We're not scared to ask you the hard question. I'm just thinking out loud.
Right
Uh,
now.
I'm sure there's some people here in this call. We're here because of you. Um, you know, your best interests. You know, you might spend 5,000 more a year, but the ROIs could be so much higher than going to another invisible place.
And so you're thinking this might be a really good thing to
Like,
put.
like we need to educate the clients, the public. I mean, that's the barrier, is that they need to know I mean, somebody that never had therapy, all of a sudden they had a bad marriage breakup, they're depressed. They go online, it's gonna be hard to compete with the marketing budgets of these large companies that have hundreds of thousands of dollars to spend a month. But I think the more we can elevate and educate people, so I don't know, like,
Yeah, no, I mean, let's open it for some discussion for a minute. I'll stop sharing, and um, for those people you have who can come in and talk about it, and I will too. Like Brian's talking about the importance of educating your clients, of letting clients know that there is a real difference in terms of what they can get from you versus what they're going to get if they go to a telehealth provider. What what other things stand out, or have any of you had connections with that have made a difference or make a difference? I saw your note, Lorraine. I will speak some to that. Anybody?
I could add a comment. Hi, my name's Mandy, speaking to you from Australia. I work as a more experiential based and creative arts therapy base. I'm just wondering about the evidence that is emerging around the benefit of face-to-face contact. So I guess sort of more research that's being done in the neurobiology effect of, warm bodies in the room, the way that our bodies both somatically and really neurologically respond to each other. I'm wondering if that could be good support for or evidence for face-to-face contact and more personal contact. And just also the benefit of a longer-term relationship, sort of what that does for the therapeutic space.
Yeah, so that could be part of what Brian's talking about in terms of an educational document.
Yes, and how we can promote our sort of smaller scale services. Thanks.
Yeah. Let's
Marie,
take,
Yes, I think that because I'm in the process of I'm kind of in this strange situation where I'm practicing in the US on a visa that I can't have my own private practice, which I would very much have otherwise. So I'm employed with a group practice that right now is not owned by a tech company, but it's kind of growing and headed. They're having to do a lot of things with their marketing that feels very aligned with that kind of marketing sales. It's just very soul wrenching as a therapist to be in that situation. And so one thing that as therapists, even as I'm working with their marketing for LA-based satellite office that we want to open here, something about therapists in private practice starting to, even as you create your marketing for your private practice, put on your websites, hey, this is not owned by a tech company. The field is changing by choosing us, by choosing this kind of service. The fee might be different, but the kind of care to educate clients when they get on your website or on your marketing material, to let them know that the field is changing, because most people don't know, don't care, so I think it's on us to make that explicit when we talk to clients through our marketing, to explain to them that, hey, when local businesses are like, support our small local business because this and that, and some people will go for that because they do care. So I think that can be a way for therapists in private practice to advocate and do some activism on behalf of our field and profession. Also, because I think the situation with the private equity companies and all of that, there's already, in my understanding, experience, a lot of issues with social justice issues within the field already of therapists, with white fragility and racism and all of those things. We're already having to work with that, and then being employed, what you referred to earlier around what happens in the room with clients when you're being reviewed, when there is all this like pressure to not upset, to have the person feel good right away and all of that's only going to make those issues even more erased, I think, from the conversation. And so something about therapists leaning in our marketing to educate people, even if it's in a paragraph, to let them know that if they choose this kind of practice, that they're also, as consumers, impacting the future and the state of the field.
thank you. Let's take Kay, and then I'll add some things.
Koi's coming from the intergalaxies. Do you want to let Koi?
Thank you. Yes, I was doing the Jedi Festival as a therapist because the Tao Te Ching kind of follows some principles of mindfulness and all that good stuff. As far as, I mean, the easiest solution based upon my experience is talking to people who have been let down by BetterHelp and Talkspace and other apps. Is that if there was a way to do the education piece, maybe through a link that we could have on our social media, such as a QR code like Psychology Today. If you're verified by Psychology Today, you can have that and put it on your webpage or other social media. And then perhaps a link to perhaps our licensing boards or even an agency who just checks the box. Yes, we're qualified to do independent practice and we've passed our licensure, and this is what you get when you work with an independent person and educate the public in that way. So it's got to be easy for people in the social media world. But I do think we need to outreach to our licensing boards and get some sort of check verification. And I do.
I'm sorry to say this, but a lot of them are already in bed with the private equity company. Now I probably could get sued for libel for saying that, but no, I mean it's very what you're saying, Kay, is very important. And you know, I heard Brian volunteering to start this kind of document and probably even some kind of verification. But one of the other things that would be good to educate consumers about is that when you're on these platforms, there's huge turnover of therapists. And so sometimes a client loses their therapist like that without even any kind of termination. And so that's another very important thing, I think, to educate the public about.
So can we do something as a group where we have a page where we've gone through the process of saying, yes, we've passed our licensing board. Yes, we're an independent practitioner, and here's the education, the science behind why it's best to work with an independent practitioner, so that it may look like a check on our website, but it links to the education and that it's the same stuff for everybody.
Yeah, and again, to be clear, we're not advocating against telehealth. What we're talking about is the private equity and the big business who's determining salaries, who's determining the length of a session, who's determining so many aspects of the treatment. So that, one of the things on your checklist should be something along the lines of decisions about your treatment will be made between you and me, not because I have to adhere to the regulations of a large company.
Yeah.
Are you okay for another question from Joel, Ellen?
Yeah, or comments as we're discussing what to do. Yeah, Joel.
I wonder about the licensing law about going across state lines and whether or not they're assigning people just in their state where they're licensed or whether they're respecting that. And rather than us just doing individual stuff on our own websites, it seems like our professional organizations should be representing us, and a place like Psychology Today should be educating the public about their standards for inclusion and exclusion, and so that we make much more, maybe, by writing to local papers or national outlets about the pros and cons of this kind of thing, or maybe consumers reports or some other organizations that would have much more public viewing than just our own individual websites.
As things have tightened down since the pandemic, I think many of these companies are only referring in state, and now there's also some states who are making it possible for therapists to work across state lines and banding together. So you probably won't get them on that, but some of those other things you were saying are really part of a whole educational process. One other thing that I think is important is therapists getting together and really knowing, like having a good, solid referral network, knowing that you're going to support each other, knowing that you're going to refer back and forth, and that you're going to be educating your clients along the lines we've been talking about. Why would you pick this person that I'm choosing to refer you to? For example, if you're the individual therapist and you want them to see a couples therapist, or if a child in a family or a relative needs somebody, why you would recommend the person. And, I think a lot of the consumer public doesn't realize the huge difference between a really skilled practitioner and somebody who's following a very specific protocol, even when some of these texting companies have, a pre-written text that they send back to the client. And so part of that whole education about having a network and knowing who's in your network and how you actually do collaborate in terms of the work that you do together.
We haven't mentioned the cost that they charge people for a session, and how does it compare to our private?
It's less. Most of them have different rates. Like if you only want texting, or if you want therapy every week or whatever, but they do try to bring people in. If anybody is on here who's worked for one of these companies, you can probably speak to it. I've seen anything from $100 for a session down to about $45 and everything in between.
And the other thing, Ellen, somebody brought out, it's not a level playing field that they've been able to negotiate with Cigna, other corporations, higher pay rates. And it seems like we should be fighting that everybody gets paid the same. Like some kind of lobbying.
Yeah, and when I had two chilling experiences at the Evolution of Psychotherapy conference last December. The first one was I've gone to that conference or spoken at that conference now for many years. And in all the early years that I ever went to that conference, when you would go into the exhibit hall was filled with therapists who had tables or books or whatever that were showing the creative work that they were doing. So you might be able to talk to somebody and learn about play therapy, or you might be able to learn about CBT or whatever it was, but you could go on and spend time in the exhibit hall learning about other approaches you might want to learn. This time, 90% of the exhibit hall was filled with providers like BetterHelp, like Alma. I did talk to Alma, and one of the ways that they were working hard to recruit me in that situation was explaining to me how they are now the intermediary between you and the insurance. So they're going to save you lots of time because they'll take care of that, interaction with the insurance company. And so that you don't have to do that. And so they're saving the insurance companies money, they're saving therapists time, and they're taking over that market.
We're putting together a summit in November. Everybody will be invited to on just best business practices. So this conversation's really helping me shape it different ways. But things I think everybody on the call can do is, one, emphasize your personal connection and trust level is a whole other level. That your client-centered care, that you're there for the client, and ability to differentiate your service, whether it's working with couples or LGBTQ, and that I'm sure the people in this call have much more cutting edge therapy in their pocket than somebody on any of these networks, percent wise. And then the other thing was just strengthening your brand as much as possible. And I think somebody said networking. I was with a bunch of functional medicine people earlier this week, and they're all networking. Hey, I work with immune deficiencies. I work with inflammation, like local networking, and then leverage technology wisely. And that's why we created the wisepractice.io. I'm not here to pitch that as much as we built this. We were paying $500 a month for our CRM system. We priced this right now at $127. And I know there's a lot of practice elements out there, software, but it also has complete marketing from Facebook to holding your website. So if that's not the tool, just make sure you have the right tools for scheduling, just to save you time. And just hold on to your ethics. Like, it's so strong and it's noble.
You're so right. Diane has, I think, had her hand up for a long time, so maybe.
Well, I was hearing some comments about, kind of getting a certification thing that we're licensed, and I'm an associate, and I lost all my nearly 2,000 hours that I earned without any pay working in community mental health, and now I have to start over and earn my hours, and I live and work and trying to work in a very high need area and can't get hired. And so in my Indeed and Glassdoor inbox is full of these, tech companies advertising for jobs. Most nowadays I'm seeing they mostly want licensed people, or they're calling the associate level licensure instead of registration. And then local people, even there's the pay just stinks. Like for a postgraduate level professional who has experience, one local place is offering $21 an hour. And I just I can't, it just drives me, it makes me so angry. This whole thing, it's like the capitalization, and I'm losing my words because I'm so excited by this. But I think I'm glad that you're starting this conversation. And I think it would be cool if people were interested in somehow, if we could make a community of practice and share our strategies, network, write articles that we can then send to our professional organizations, send to Psychology Day, to put out there in the public. Like Joel said, I'd be way into doing that. And I'm working with some people to start a nonprofit, because I must work in a nonprofit with the second registration number. And I really want to emphasize that associates should be paid a real wage for a professional, and so they'll stay put. And that way, and places that are hiring associates, instead of making money on them, they should provide really excellent training as well as a real wage, so that they can just stay put, get their hours, and start treating people with the tools they need. Because a lot of places, associates go into the highest burnout places, get paid crap. They don't even make it to licensure half the time,
Diane, I hope you will use your anger constructively to do what you're talking about, because no, the field needs people. I mean, my way of doing it is to write articles. My way of doing it is to make presentations like this. My way of doing it is I have a large community of couples therapists, and we are really working out not only how do they support each other, but how do they collaborate therapeutically on their cases, so that they really are, when it's needed, they really are referring back and forth to each other, and they're educating their clients on the things that we're talking about.
That's what we need.
And so, I mean, I'm one person and I'm doing what I can, but all of you can do things. I mean, and we should, because the amount of money that is being spent on advertising, it is possible these companies will go bankrupt. I mean, I can't predict it. I don't know for sure, but I did see something just in the last couple months about BetterHelp having to pivot because their income has gone down since the pandemic. And so now they're trying to work with more insurance contracts, but they're feeling the pinch. And if they continue, they still haven't made a profit, partially because they pay their CEOs millions of dollars. But anyway, I'm really crying out to everybody who's on this call to do, even if it's one small thing, like the kind of education that you're doing to your own clients. You never know who they're going to talk to and who they're going to tell. Dawn, you.
Thank you. Two things, I'll try to be really brief. One is I hear you about this hope that maybe that some of them will start to fall apart. There is one glimmer of hope. I was a provider for MeMD. I didn't see very many clients on it. I hated it. The documentation was horrible. The rules made it hard to connect, like your earlier example. But also they were acquired by Walmart when Walmart launched Walmart Health. And just very recent, and I got out of working for them before that, or around that time. Just recently, I saw a news report that Walmart is closing their Walmart Health, telehealth, online, both the medical and the behavioral health side of that.
But you get a free pair of steaks when you sign up.
Pardon me?
You get a free set of steak knives when you sign up. So, all right.
Yeah, seriously. So that's one glimmer. The other thing I was going to say is my blood boils every time I hear BetterHelp advertise on things like podcasts and on NPR and things like that. And so I haven't done this yet, but this is going to hold me accountable. I feel like I need to start exercising my voice and putting my dollars like to NPR or other podcasts that want you to be a subscriber and say, I will not subscribe to you, or I'm going to boycott you in a way if I can, and get other people to boycott you if you keep advertising BetterHelp, and be able to talk about why I, as a mental health professional, I'm an LCSW, do not think that they are an ethical service. So I would like to invite other people to maybe consider that. If you hear BetterHelp advertised somewhere, see if you can get your voice to be heard. I haven't done this yet, but I'm saying it aloud to all of you. So empowering myself, emboldening myself to take the time to do that. They are definitely unethical. I heard your onboarding story back in 2018. I had a similar bizarre onboarding experience where they just like dumped me. It was so unprofessional and bizarre, and they do pay really poorly, and it's not good to make people think that their therapist is right there when you snap your finger, and that texting is actually therapy. All of those things, in my view, are not ethical. So that's all I have to say.
Thank you, Dawn.
Yeah, thank you very much.
Vanessa, who, when I was preparing
Hi.
for the webinar, she had a brilliant blog that I read like 4 times and took all
Oh,
your
thank
pictures.
you.
So
It never got picked up by like anyone big. I was really disappointed, but a lot of people are talking about, I think, even in the normal discourse online about like everyone being in therapy and what's going on with that. And I think drawing the connection clearly to folks that we're being told certain things by major companies is a big part of the puzzle. I think that's really enlightening. One question I had, or one kind of comment, is that I'm noticing a lot of young clinicians feeling the need to really put themselves out there on like TikTok to keep up sort of with, I don't know, just wanting to self-promote and out of fear, probably because the industry has shifted so much. Is there anything that you're noticing with that? Or like, that just feels like another beast to tackle. More education, I think, to consumers, but anything that we can be doing to try to dissuade these younger clinicians. I say younger, I mean, it varies, but it just feels like another difficult piece to tackle.
I mean, this is not on a big scale, but you're right, that younger clinicians are really, the ones I've talked to are very afraid that they're not going to be able to make a private practice living. They went into school expecting to be able to do that, and now they're very frightened. And so they will move towards things like they're talking about And anybody who's on this call who's experienced and can reach out and support some of these younger clinicians. I take some of them in my training program free. Sometimes I help them get consults or teaching or learning. We need to be supporting the young clinicians coming up. Very much so.
Thanks, Vanessa.
The other thing, I think that we're all up against is, do you know how many diagnoses there are in the ICD-9 now? Does anybody know? Just put your guess in the chat. I see too many. Too many. Yeah, there's over 70,000 diagnoses now of the human condition, in the ICD-9. And so, or ICD-10, whatever the latest version is. But for those of us who are able to succeed outside of the insurance realm, the not making a diagnosis and not being pigeonholed into having to describe things that are conditions of the human spirit and, like you said, impacts of racism and culture wars and all that. We don't need to be diagnosing people with that. Brian, where is your brain going with some of this conversation?
I think it just needs to be addressed on so many different levels. Like, I come from a marketing and technology side where I can contribute. And then I think there's who are the national organizations, like Pessie's not going to do this. Their vendors at their booths are these big companies. Psychology Today has advertising. I think it needs to come collective, and I think we should have more of these conversations. What we could do, and I just feel a commitment to support individual and group practices that are locally owned. And so, and it's really great to have a discussion, because before today, it was like your paper, our little discussions, and feeling, it's one of the Zoom calls I feel the most energy from the group in a long time. And I have somatic leadership clients, and, I really feel, pay attention to making it that we are creating a space together. So I really appreciate what everybody's doing. And I think we all need to be leaders here. Like, you're a writer, Ellyn, that's your beautiful contribution. And there's other people here that have their unique abilities.
Well, I saw, Brian, I hope I can get a copy of the chat later from you, but
I asked Bridget for it. Yes.
thank you. Because some things went by really fast that I wasn't able to read, but there are people on here who have had bad experiences with some of these companies. And most of the therapists who've had bad experiences don't share it. Sometimes it is shared, but sometimes it isn't. It's like, there's fear if I speak out against Big Brother, what's going to happen to me? And so a lot of people just deal with it themselves. And I think we need to be also just more sharing of what those experiences have been.
And I like what you said about mentor the younger people. And I remember we had a workshop with Esther Perel here, rock star status, but we went out for dinner and we literally filled my four-door Mazda with like 10 people. Esther was like laying across, and she just brought like 6 young people, and she just went around the room like, well, we were at a restaurant, like, what are you doing? What's your struggles? Like, just to really share, care for each other. And have impact.
Yeah, I don't know who it was. I'm sorry, I don't remember which one of you was the one who first said, let's put on our websites that we are not owned by private equity. I mean, just think about that. That was actually a really great suggestion because I've never seen that on anybody's website. Have you ever seen it, Brian?
Schmardart, did I say your name right? Salzman wrote something really beautiful in chat.
Can you read? Can you read?
I think I'd like her to read it.
Or that's even better.
If you're still here. I'll start it and then just please cut me off if you join. Why should I choose a private practice therapist over a therapy app or online mental health platform? And I'll post this again in chat. Seeing a private practice therapist offers personalized, consistent care with a focus on your unique needs, background, and therapeutic goals. Unlike therapy apps or online platforms that may use standardized approaches or AI-driven intervention, a private practice therapist provides a human connection, builds a deeper understanding of your personal history, and can adapt treatment in real time based on your progress. Additionally, private therapists prioritize your confidentiality, whereas online platforms may compromise client information due to data sharing. And when I was doing research, there was one big lawsuit about that, like sharing data with Meta, I think, in Google, and often prioritizing shareholder profit over individual care. This personalized interaction facilitates a more nuanced and effective therapeutic relationship, which is crucial for addressing complex or sensitive issues. So I don't know if she's here to let other people use her copy or you can come up with
I think she said at the top, I think she said, feel free to copy and paste or edit. So I think she must be willing to share it. Yeah, that is really well said. And you're right, Brian, about the lawsuit. There was a sharing that was going on. Both Talkspace and BetterHelp, both of them have had significant lawsuits.
and maybe the most effective straight, maybe Peter could write like a little comedy skit that we can get on YouTube.
That would be good.
McDonald's and
here, I'll share another paragraph just as we sprinkle his writing through. He says, we need to pay therapists less so we can compensate our CEO with over $6 million a year because we believe people should get paid what they're worth, starting with our CEO. And the other corporate officers also need high compensation because people should get paid what they're worth. If we paid therapists more, we might have to reduce some of the benefits we give to our executives, and we never would want to make them unhappy. We hope you therapists understand this is how business works when you're not a licensed therapist. P.S. We love to advertise to the public that we deliver affordable mental health services because the public thinks we are engaging in a noble cause. So let's go back. I saw Hannah and then Marie too.
All the discussion, I haven't heard anything about supervisors and supervision. And I think that that's an area I'm right now, I'm too, let's say, I'm over the hill, and I don't take clients anymore, but I do a lot of supervision. So I think that that's an area that you need to also emphasize and to do something that the therapists know who are the therapists that are the supervisors that are actually licensed and actually okay for them.
Yeah. I mean, and again, it would be great if lots of supervisors would take some of the young therapists.
I do that. I take young therapists and I take therapists at a very, very, what I think is a low thing. Like I take $40 an hour.
That's very reasonable. Thank you for what you're doing.
And I find that it's very important because the therapist needs supervision. And
Sure.
even licensed and therapists that are already practicing for many years, they also need supervision.
Yeah,
So
well,
we have
I mean, that,
supervision groups. I have a group of supervisors that we meet together once a month, and we do kind of peer supervision.
I mean, again, that's great, and that's your contribution. And, clearly, hopefully, you're educating the young people that you're supervising the importance of them learning how to exist outside of these platforms.
Yeah, yeah.
Marie?
Yes, thanks. I'm laughing because I saw I think you were in Esther Perel's session. You supervised Esther Perel. So I'm like, they do get supervised. But I was thinking, it's great to have you, Ellyn, in this event. For example, because another thing that I'm thinking about is how can quote unquote like big therapists who are established, and now that the world it's the therapy's time, like people, it's very being popularized and spread across the culture. How can more established therapists can, when they go on podcasts, for example, to promote their work and bigger events and all of that, how, like with social justice issues, but also how can potentially therapists who aren't so concerned about making a living right now can, use the platforms that they're being offered to put that into, how the field is really changing. And again, it's like with any environmental climate, like how can consumers make a difference with that once they know? So anyone who has a voice and a platform to also, throw that in out of solidarity.
Right. And I mean, anytime you connect with anybody like that, Brian will have, I assume this will be on his website. It's going to be on our website. Somebody who couldn't be here today can still listen, or read the network or article that I wrote. But yeah, the more we can get people who do have bigger platforms, and I talk about it a lot with people in our community and my colleagues who do have bigger platforms, because I feel so strongly about it. Brian, I don't know if we have anybody else, or
I think it might be a good stopping point.
yeah, would you be okay if I invited folks to our free training that's coming up?
Yeah, go for it.
Yeah, no, I would just like to invite anybody who's here to join us at the Couples Institute, doing a program in September called What Do You Say When, which is just a little over a week of free training on dealing with tough moments in psychotherapy. I think Monty can put a link in the chat where if anybody wants to sign up and join us, we'd love to see you. Part of support for me, part of supporting Brian and other colleagues is places that are doing quality support for therapists. We also, I think, need to be supporting each other's work. So thank you for the little commercial here at the end.
And I'll put my email address also in there, and let's stay in touch what we could do. I know we'll come up with some copy. Love your input. Because it needs, we always do in our company 80 rule, like you get 80%, and you might have a legal perspective, you might have a clinical clinician perspective. So maybe we can come up with some really couple different copies people can put on their website that varies. I think we have a great start with one.
I mean, that would be excellent.
And we're really here to support you growing your practice and winning.
Yeah, absolutely. Well, thank you for the invitation to be here, Brian. I appreciate it.
Oh, it's so good to connect. We had a wonderful dinner like 10 years ago with Diane Pohl-Heller, Stan Tatkin, Dick Schwartz, and it's nice to reconnect with you, and I really appreciate the work you're doing in leadership. And I think it's an example for all of us to do whatever leadership, writing, speaking, protests, whatever your cup of tea is.
Yeah, absolutely.
Thank you all
Okay.
for your attention. That was like 90 minutes of your time, so it's really valued.
Yeah, thank you.